Go ahead.
So, a very good evening to one and all. At the outset, I would like to thank AIOS for giving me this opportunity. Limbal stem cell deficiency, as we all know, is caused by decrease in population or function of corneal epithelial stem cells, which is important to sustain the normal homeostasis of the corneal epithelium. The staging of LSCD can be as in stage 1, it is the central 5 mm of the cornea is not involved. In stage 2, the central 5 mm of the cornea is involved. However, limbal involvement is less than 100%, and in stage 3, it is the entire corneal surface that is affected. Limbal stem cell transplantation offers a solution by restoring the corneal epithelial cells by using healthy limbal tissue. Various surgical techniques, including conjunctival limbal autograft, CLET, and SLET, have been described. However, simple limbal epithelial transplantation, that is SLET, that was described by Dr. Sangwan et al., has gained popularity because of its minimal learning curve, predictable outcome, and cost effectiveness. Traditionally, the use of human amniotic membrane is considered a critical step in SLET surgery because it provides a scaffold for epithelial cell proliferation and migration. Amniotic membrane is used as a basement membrane for epithelialization. Complications of using amniotic membrane is very rare, though we can see blood under amniotic membrane, haze with amniotic membrane, and folds in amniotic membrane. So we had published a modified approach to SLET where we did not use AMG, and the limbal transplants were placed directly on the corneal surface. This brings us to the aim of today's paper, that is to compare the outcomes of SLET without AMG versus with AMG in patients of limbal LSCD. So this was a retrospective case study of 16 patients with partial or total LSCD. The group A patient had underwent SLET without AMG, and group B patients underwent SLET with AMG, included 8 patients each. Patients of total or partial unilateral LSCD with good follow-up photographs and documentation were included in the study. These were the data that was collected and analyzed. Complete success was defined as complete epithelialization, totally avascular corneal surface. Partial success was if there was a focal recurrence of symblepharon not involving the visual axis, and failure was unstable ocular surface with persistent epithelial defects or symblepharon involving the visual axis. Standard surgical technique was used in group B. However, in group A, the only modification was AMG was not used after the Pannis dissection, and the corneal limbal transplants were placed directly on the host corneal bed. So coming to the results, these are few of the cases. This was a 72-year-old gentleman who underwent OSSN excision and developed a total LSCD after that. He underwent SLET without AMG, and we can beautifully see how the cornea has cleared and there was no evidence of scarring, inflammation, of recurrence of LSCD at 8 months. This was another 8-year-old girl who had sanitizer injury and developed LSCD after that. So she also underwent SLET without AMG, and this is her 8-month follow-up with beautiful and no recurrence of LSCD. This was a third case, a very old chemical injury with an inferior symblepharon. He was also managed with SLET without AMG and with conjunctival autograft. Here also there was we did not note any recurrence of LSCD. This was another patient with who underwent chemical injury, acid injury in 2005, had total LSCD with superior symblepharon. He also underwent SLET without AMG, and this is his post-month follow-up with a vision of 6/12. So these are the demographic details of patients in group A, that is SLET without AMG. In group B, that is SLET with AMG, 3 patients with total LSCD had faced a focal recurrence in the form of superior symblepharon, which were very beautifully managed with conjunctival autograft. As we can see here, here also there was a focal recurrence noted at 2 years, which was managed with conjunctival autograft and is still maintaining at a 14-year-old follow-up. This was again a 11-year-old follow-up, and after SLET, 3 years after the surface had stabilized, we performed PKP, and his 11-year-old follow-up is still maintaining a vision of 6/9. These are the demographic details of patient in group B. So long back in 2015, we had published epithelialization pattern of SLET with AMG, and to our surprise, we found a similar healing pattern in SLET without AMG also. The mean duration of epithelialization after surgery was 2 weeks. There are many papers who there are many papers who have described modified slit technique where AMG was used as overlay or inlay. To the best of our knowledge, this is the first study to compare slit without AMG and slit with AMG. So to conclude, the present study suggests that epithelialization of limbal stem cell explants can occur without AMG, and presence of AMG is not a rate limiting step. AMG, although it acts as a scaffold, its absence does not appear to hinder the process. Additionally, transplants remain securely affixed to the corneal surface even when secured with fibrin glue, and results presented open the door to potentially simplification of already a simple procedure, reduced cost and avoidance of associated disadvantages. Further research and larger cohorts may be required. Thank you.
Nice paper, Dr. Vishwa. I have a question for you. So this is a case control study, correct? You have retrospectively analyzed cases that some which had with AMG and some without.
Yes.
So there definitely must have been a selection bias as well, no?
Yes. This is relatively newer technique. So so the mean duration.
Would it be safe to say that you chose more of partial LSCDs in the without AMG group?
That is how we had started doing it.
Yeah.
And now we are also doing it in the total LSCD cases, and we are getting equally good results, but longer follow-up would definitely be required.
Yeah, I think more than longer follow-up, you need a randomized controlled trial to actually compare head to head.
Prospective.
Prospective.
Because otherwise the selection bias will always be there. You'll take the milder cases and do without AMG.
I agree.
And then that will bias your outcomes as well. So mean time to epithelialization in the group B was less or was more?
It was almost same.
Almost the same?
Yeah.
Okay.
2 weeks. 2 weeks. 2 weeks for both, yes.
Okay. Thank you very much, Vishwa.
Thank you so much.